Hey everybody, how's everybody doing? We're just going to give it about 1 minute, just so plenty of people have an opportunity to join who plan on joining, and I'll be right with you. Get some water, stay hydrated, right? It's a health and wellness webinar. Got to stay hydrated. Be a good example. Okay, so let's jump into it. Thanks for joining, everyone. Quick disclaimer as usual. I need to be very clear in that this presentation is intended for educational purposes only. I am not a medical provider. This is not medical advice, not intended to diagnose or treatment recommendations. Although I am a scientist, but I studied political science, so that doesn't go very far in this world. So this is really intended to be to stimulate thoughts and keep everybody up to date on current research. This information is not intended to be marketing or promotional materials. I am not specifically endorsing any specific products or brands. I am simply here representing myself and Kaizen Innovations. I am not liable for how this information is interpreted or applied outside of educational context. My goal is really just to share general knowledge, emerging research, and it's very important that I'm crystal clear. This is not direct clinical advice, suggestions. I encourage everyone to view this through view this content through the lens of using individual judgment and regulatory guidelines. Again, this is educational purposes only, not medical advice. So today's presentation, we're going to be talking about libido and sexual function. Obviously, it's an extremely complex and dynamic aspect of human biology. It plays a central role in intimacy, connection, relational health, and is a huge piece of just being a human being. So it can vary widely across individuals, different lifespans. It's often a reflection of broader physical and psychological states. So understanding the factors that influence libido help support and informed, respectful conversation in both clinical and personal settings. So this presentation will focus on the biological pathways involved without making any claims and explore emerging areas of research and interest during centrally acting peptides. So let's jump into it. So starting off really broad, right? Obviously, this is multifactorial. So there's no single switch or silver bullet when it comes to sexual wellness or performance. It's really complex. It's a layered system. It really needs to be addressed in the way that it is with multifactorial. So there's multiple areas of there's multiple areas that are really going on simultaneously. So things that we're going to get into today and cover everything from hormonal factors. Obviously, in my opinion, this is the foundation not only of libido and sexual performance, but kind of a greater perspective from my perspective in history, really, this is foundational for health, right? It's what, and often in a big sense, it's really what makes young people young. Additionally, neurotransmitters are going to play a huge factor. Libido is neurochemical. Dopamine drives the desire and reward system. Oxytocin governs bonding, especially post-orgasm, but also during anticipation. Additionally, there's a huge component of vascular health, the importance of blood flow and healthy endothelial function. And then we're going to get into psychological factors as well, including stress, anxiety. Mental and emotional well-being is often overlooked when it comes to its role in libido and sexual function. So, testosterone. Again, I think hormones are the foundation not only for libido and sexual wellness, but for health in general. In both men and women, I think oftentimes, too often, low testosterone is overlooked, especially in women. Everybody knows that men need testosterone. A lot of people don't understand the importance of testosterone in women. I worked for a hormone replacement therapy company for many years. It's hugely impactful, hugely powerful. I've been hugged by strangers on the street and told it's like coming out of a coma. Everything from energy, libido, sense of well-being, huge percentage of individuals get off of antidepressants when their hormones are optimized. So this is one that's very, very close to my heart. So although libido is certainly a hugely correlated to hormones, that's not the only component. So testosterone, talking about the mechanism of action. So testosterone is really unique in that it works both centrally in the brain and peripherally, actually in the body, to influence libido and arousal. So in the brain, it activates androgen receptors tied to motivation, attention, even reward-seeking behaviors. That includes sexual motivation. So it also supports dopamine signaling, which helps with desire, pleasure, and goal-directed action. At its core compound, it's really critical for a healthy libido. In the body, testosterone affects genital blood flow as well as general blood flow, tissue sensitivity, muscular tone, which is all important for performance and even confidence. In women, even small drops in testosterone can translate into a reduction in sexual desire, vaginal sensation, or even emotional drive towards intimacy. So it's not about bringing patients to physiological levels, but really about bringing back a healthy balance and optimized perspective, optimized levels. So in a clinical setting, restoring testosterone, my perspective is to optimal levels leads to noticeable improvement in sexual motivation, confidence, performance, sometimes as fast as weeks. Men often report that initiation of intimacy, improved erections, better physical presence. Women describe the return of sexual thoughts, stronger orgasm, or even it's been described as really just feeling like themselves again. Dosing should always be individualized and monitored with labs. Overdoing can lead to issues including irritability, oily skin, hair changes, or estrogen imbalance. For women, topical or subcutaneous dosing at low levels is often preferred rather than injectables, as that can lead to androgenic effects. Testosterone is rarely the full story, though, right? So it's always important, in my perspective, to use this as a starting point. Um, Many members of my family, their hormones are optimized, and personally, I've spoken with hundreds of individuals due to my history working in testosterone that have had incredible results. I've literally been hugged by strangers. All right, so when we get into peptides, first one we're going to cover is melanotan-2. I think this is important to cover first because it was one of the early peptides to be discovered that correlated with sexual function. And actually, initially, it was being studied for photo protection. Essentially, it's kind of like a sunless tanning technology, for lack of a better words. So it can also affect appetite, sexual function. And it's interesting as it acts on a non-selective binding to your melanocortin receptors. This is not FDA approved. It's not approved for human use. So everybody needs to ensure that it's being studied appropriately. How does it work? So again, melanotan-2 activates multiple melanocortin receptors. So a total of including MC1R, which drives pigmentation. Again, this creates a tan without even requiring sun exposure. Bro science, the way I would describe it, is essentially it's like steroids for your tan. I've personally used this and I got real tan and I felt great. It does have impact on appetite and sexual function. Also, it will influence metabolism. It does have a long half-life, so it will stay in your system for quite a while. I've probably used it 6 or 7 times, and I have Irish skin. I'm fairly pale, and I had a great result. Really prefer aesthetically being tan as opposed to pasty pale. So, when we're focused on the sexual wellness relevance, so again, melanotan 2 stimulates melanocortin pathways involved in sexual desire and arousal. So, it's been reported that it can correlate with spontaneous erections, enhanced libido, increased sexual fantasies are very common, and often very strong with PT141. These effects work independently of any physical stimulation. And so, again, other systemic effects that can impact appetite suppression, mild mood elevation. There are some risks associated with it. Individuals who have a history of any type of skin cancer are not good test individuals, essentially. Additionally, again, potential nausea, facial flushing, and there have been some instances of priapism, essentially erections that would not go down. So, PT141, pretty fascinating history. And actually, PT141 was originally discovered during research of melanotan 2. So, this is a synthetic, which is the peptide we just covered. Oh, one more detail about melanotan 2 is that it will, and what I've seen personally, is it will make any freckles or moles that you have get darker. So that should always be considered. So essentially, during the early trials of melanotan 2, researchers found that participants were reporting stronger increases of sexual desire, spontaneous arousal, and even erections, sometimes without sexual stimulation. So the researchers saw that and narrowed it down to the specific amino acid chain being PT141. So essentially, PT141 was carved out of melanotan 2. It does not affect your skin, and so PT141 will not give you that sexy bronze tan if anybody is not looking for that. And essentially, after years and years of development, it was FDA approved, and the trade name is Vyleesi. Specifically, it was approved for premenopausal women with hypoactive sexual desire disorder. It's administered via sub-Q injection, typically 45 minutes before anticipated intimacy. To be really clear, while it is FDA, Vyleesi is FDA approved. It's currently extremely limited in women. Off-label clinical use has expanded rapidly, but especially in men and women's wellness clinics. So really think of PT141 as like filling the gap that most sexual health medications don't address. It works on the mental and motivational side of libido. So how does it work? Earlier I mentioned the hormonal and neurotransmitter and vascular and psychological categories of sexual health. PT141 doesn't really fit in any of these boxes. It's not a hormone. It's not a classic neurotransmitter. It doesn't activate blood flow, unlike Viagra or Cialis. And it's not a psychological or antidepressant style product. So it's really best described as acting on it's a central acting neuropeptide. So it works in the brain by activating melanocortin pathways, influencing dopamine and arousal centers. So it really more addresses the mental and motivational side of desire, not just performance. So it bypasses the nitric oxide pathway. Again, when it comes to blood flow, think of drugs like Viagra and Cialis. And instead, PT141 activates the melanocortin receptors, specifically the MC3R, melanocortin 3 receptor, and MC4R in the hypothalamus. So this pathway boosts libido and arousal at a neurochemical level, affecting motivation, anticipation, even mental engagement. So core potential benefits research is exploring: increases sexual desire and mental arousal, enhances even the strength of orgasm, improves emotional connection and relational intimacy, and helps restore confidence in a lot of situations. Benefits to men: it supports erectile function, particularly in men who don't respond to PDE5 inhibitors like sildenafil and tadalafil. can be used in combination with ED medications to enhance effectiveness, especially effective when the issue is mental arousal or confidence, not just blood flow. Benefits for women, potential benefits for women, rather, it increases libido and desire without altering any hormonal levels, particularly helpful in perimenopausal and postmenopausal women who aren't candidates or don't want hormone replacement therapy. So again, I these are this is not medical advice. This is simply I'm getting all this information using a reference guide from Dr. James Laval's book, The Peptide Handbook, a Professional's Guide. Thank you, Dr. Laval, who was previously the president of the International Peptide Society. So, dosing protocols as published in the clinical reference guides and endorsed by the International Peptide Society, PT 141. It really, essentially, it's the top libido enhancing peptide. Men typically will start at 1 milligram 2 hours before sexual activity, and women often need 2 milligrams for really a noticeable impact, and that's 30 minutes all the way to 6 hours potential onset. Duration, the effects, some research indicates the effects can last up to 24 hours, which that's quite a long time. It should be limited to 2 times a week, not for daily use. Main side effect that research indicates is nausea, but that can vary, and it also will reduce appetite. Oxytocin. Oxytocin is pretty fascinating. It's often referred to as the love hormone or binding hormone. It's naturally produced in the human body in the hypothalamus and plays a key role in childbirth, breastfeeding, and even really just human connection. It's released during physical touch, orgasm, and moments of intimacy or emotional closeness. So often deepening connection and attachment between partners. Mechanistically, oxytocin acts on the limbic system, influencing trust, empathy, and emotional regulation. So it's really not correlated with arousal per se, unlike PT141, but more of an emotional amplifier. So clinically, sometimes it's used off-label. There, you can access it potentially through a nasal spray. It's often utilized as couple therapy setting as well. Again, not a libido booster, but the emotional component of sexual wellness needs to be looked at closely because that's a huge component, right? So patients often describe this as like a shift in tone, feeling more affectionate, less reactive, more inclined to initiate closeness. So these subtle changes can help couples re-engage when emotional disconnection has taken its toll on desire. I've used some products that include oxytocin, and it made me feel great. I think I was calling friends I hadn't spoken to in a while and telling them I love them. It was okay. So Endotest is actually kind of a unique product, and this is a combination of two products, kisspeptin and oxytocin. Essentially, in short, kisspeptin's been around since 1996 and has actually been studied for potential anti-cancer properties. Key role in triggering puberty and regulating fertility. It binds to GPR54, which is gonadotropin releasing hormone, which is in the hypothalamus. So essentially, it stimulates gonadotropin releasing hormone, which then has a downstream effect of LH, luteinizing hormone, and FSH, follicle stimulating hormone. So this is really central in reproductive hormone signaling. And additionally, oxytocin, which we just talked about kind of at length. But there's potential synergy between these two compounds. Kisspeptin regulates the hormonal state, and oxytocin supports emotional bonding. Together, they may enhance both physical and emotional aspects of fertility and intimacy. Growth hormone secretagogues. So we've talked about these at length. I'm not going to get into any specific growth hormone secretagogues, but understand that, in my perspective, growth hormone is kind of a umbrella all-encompassing kind of important hormone that correlates with everything from muscle retention, sense of well-being, sleep. It's kind of comparable to testosterone in some ways. And when you're using a growth hormone secretagogue, for example, sermorelin, CJC 1295, ipamorelin, tesamorelin, they all work slightly differently, but the end result is essentially the same, where we're trying to stimulate the body's own natural production of human growth hormone. So originally it was developed to improve metabolism, recovery, body composition, and now they're being used a lot more, just kind of broader, more vitality and wellness protocols. While not direct libido enhancer, they do improve energy, sleep, mood, even confidence, all key factors in supporting healthy sexual function. Tesamorelin is notable because it has been shown clinically to reduce visceral fat and improve cognitive function with boosts in stamina and self-image. I do want to make one statement about that is yes, tesamorelin does have this research behind it, but in my perspective, a potential reason that might be is tesamorelin was specifically studied for that, but sermorelin, CJC 1295, ipamorelin, if all of these chemicals are stimulating human growth hormone, I would strongly imagine that they all would have those same benefits, benefit of visceral fat and cognitive improvement. So overall, these peptides potentially can create stronger physical and emotional foundation for sexual wellness. Mechanism of action, again, these peptides work differently, but essentially they're all triggering the hypothalamus and the pituitary to trigger more growth hormone release and maintain hormonal rhythm. BPC-157, TB500, classic, right? These are two of my favorite peptides. If you've been on the webinars in the past, you've probably heard me talk about them at nausea. They're very broad in the benefits and how they work. So today we're going to be focused on sexual wellness and libido. And so briefly, BPC-157, originally discovered in the gastric juices and in the stomach lining. TB500 is essentially the synthetic version of thymosin beta, which is involved in tissue repair and cell migration. So both of these are widely used in regenerative medicine to promote healing, reduce inflammation, and improve circulation. Common uses: recovery, joint pain, even nerve inflammation, gut inflammation, post-surgical repair. I do Brazilian Jiu-Jitsu, which means young men are trying to murder me with their hands on a regular basis. That leads to being pretty beaten up on a very regular basis. And using these products help me essentially live pain-free for the most part, unless something really traumatic happens. BPC-157 has been shown to support angiogenesis, so it's going to increase blood flow. It increases nitric oxide production and endothelial repair, improving blood flow and vascular health. TB500 enhances actin production and cell movement. So essentially potential for accelerating muscle recovery, nerve, and even erectile tissue micro injuries. So together, they seem to have a very impactful benefit for systemic inflammation that can impair sexual function and physical performance. Often included in sexual wellness protocols like the P shot or even the O shot to aid in tissue regeneration and recovery. Typically well tolerated with minimal side effects. Anytime you're injecting something, you could have mild irritation at the site. So commonly stacked with growth hormone secretagogues, PT141, and hormonal therapies for more comprehensive vitality and sexual health support. Cognitive and emotional support. So C-Lank and C-Max. These is another two of my personal favorite products. So C-Lank essentially is great for emotional regulation and anxiety relief. It's a synthetic peptide derived from tuftsin that modulates the GABAergic system. So it reduces stress, performance anxiety, helping users feel emotionally grounded, fosters a sense of psychological safety, which is critical for vulnerability and deeper connection and intimacy. CMAX works on the dopaminergic side, so essentially potential for focus and motivation. So this is a synthetic ACTH fragment, and it enhances dopamine and BDNF expression, brain-derived neurotropic factor. So essentially, research indicates the potential to increase motivation, mental clarity, even executive function, especially helpful in emotionally charged or intimate settings. So so thinking about CMAX, so essentially supports attention, mood, cognitive endurance, potentially during sexual and emotional engagement. Synergistically, it's essentially adding cognitive and emotional harmony. So CLank calms the emotional system, while CMAX sharpens the cognitive edge. So potential ideal for study when it comes to users who need both regulation and drive. Pairs well with PT141. Again, all this dosing is coming from the guidelines, which were endorsed by the International Peptide Society. This basically lays out the dosing. So majority of time, we're going to be using sub-Q injections. Starting dose 200 micrograms daily, can be titrated up to 300 micrograms and even twice daily. Suggestion is 5 days on, 2 days off. This is going to help ensure there's not a dulling of those receptors. Yeah, so in summary, libido is regulated by multiple interconnected systems. There's no single cause or solution. There's potential for PT141 to work as a centrally acting peptide that targets melanocortin receptors in the hypothalamus. Mechanism differs from common therapies like testosterone or PDE5 inhibitors. It does not fall cleanly in any category of hormone, neurotransmitter, or vascular agent. Um, Ongoing research is necessary, but it really represents a novel mechanism of action. So, again, these webinars are not intended to be an all-encompassing training by any stretch. This is really just to stimulate additional research. And so it's really critical for all providers to understand it's your responsibility to educate yourselves. So these are some of my favorite educational platforms where I've done the most reading and education. So peptideprotocols.io is a great option. This is a paid membership. They give comprehensive peptide education protocols and even some marketing resources, as well as consent pages. I think it's like $30 a month. I think it's if anybody is really interested in learning more about peptides, I think it's a great option. The Peptide University, slightly cheaper option, but less in depth than what they offer. Peptide education, dosing protocols, self-study courses. Both of these sites have a free peptide calculator where essentially you're going to input the milligrams of whatever product, how it was reconstituted, and it'll basically spit out the amount of units you're going to be getting for any specific dosing protocol. Books. So my favorite book is definitely Dr. James Laval, Peptide Handbook, A Professional's Guide to Peptide Therapeutics. It's available on Amazon. It's about $35. If you were to look on Amazon, you'll see two options. One of them will say out of print. The other will say $35. So do that. If you were to Google it, somebody's out there, some website will try to charge you $86. Waste the money. Don't do that. And then additionally, Dr. Seed's Peptide Protocols Volume 1, highly recommended. Another great book, very similar to the Peptide Handbook. In the best online comprehensive course I've found is International Peptide Society. And with that, I just quickly promote. So as I've said before, these are now being recorded, and I'm slowly starting to upload videos. Currently, I've got two that are currently on my YouTube page. I will do an email blast to any email that has registered for these courses in the past. Find my YouTube page, subscribe to it. You'll automatically be updated when new videos are put up. My Instagram, you don't need to follow me on Instagram. I don't really post anything of importance. I've got a couple pictures of my family. That's about it. KaizenInnovations.net is my LLC's website. You can always go there to find new hours and webinar schedules and where you can register for these Zoom calls. And so with that, I will stop